lumbar traction for muscle spasms and our patient has moderate symptoms, we are going to be performing manual traction. So the goal of our treatment is to relax the muscles, and the traction is indicated because we're going to be doing a static traction since it's manual, because that's easier to do than intermittent. So the static traction is going to stretch the Golgi tendon organ, which will then inhibit the muscle activity and interrupt the pain cycle. And then the traction can also help reduce the cause of the muscle spasms if that's caused by a herniated disc. This will also help push the disc back into place. So the first thing we're going to do is check for contraindications. So do you have a spinal fusion or a fracture?
No.
Okay. Did you have any acute injury to your back? So have you injured it like in the last 72 hours?
No.
Awesome. Are you possibly pregnant?
No.
Do you have rheumatoid arthritis?
Not yet.
Okay. That's good. Have you ever been told that you have joint hyper or hypomobility?
No.
Okay. And do you have uncontrolled hypertension?
Nope.
Okay. So we're going to go ahead with the treatment. At any point during the treatment, if your symptoms that you're having start to go other places, let me know.
Okay.
All right. So right now I'm just going to tell you how we're going to select all the parameters. So the patient is going to be supine, and then I'm going to be pulling on their legs to create traction throughout the back, so it will pull on the posterior structures of the tissue and it will help relax the paraspinal muscles. And then it's going to be a static hold, so there's no hold relax time. And then the force, we're going to start with 35% of body weight because this is the first treatment session. And then we want to progress up to 50% because that's going to help the tissue stretch out and create space between the facet joints. And then the duration of treatment, since it's a moderate symptoms, we're going to do 10 minutes duration. And then the frequency, we will do it 3 times a week in therapy, and then I can also show the patient how to do some self-traction so she can do that at home. And then as with any other treatment, you would want to assess the skin, so that her lower back before and after the treatment, and then just check with her during the treatment, and obviously cognition, which is good. So now we're gonna do it. Alright, so I'm just gonna grab her feet and then I'm gonna kind of pull, just providing a little bit of traction. How's it feel?
It's improving my pain.
It's improving her pain, good. So you'd hang out here for 10 minutes, and the therapist can use a belt around the patient and around the therapist to help just the patient prevent fatiguing. Yeah, so we do this for 10 minutes. And then, since it's improving her pain, then we would increase the length of treatment the next time. And then other interventions that can be used for her paraspinal muscle spasms are the other various traction techniques, E-stim, hot pack, or thermal ultrasound.